Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and as always, I'm excited that you're here. And we have an incredible guest today. Dr. Emily Letran is a practicing dentist with multi-specialty group practices in Southern California for over 30 years. She's also a speaker, coach, and consultant to businesses globally. And you know that she's really impactful because she has one of the shortest bios ever. Thank you so much for being on the podcast.
Thank you so much for having me. It's an honor, and thank you so much for creating a platform where we can share ideas, strategies, and learn from each other.
I appreciate that. And, from my perspective, helping put patients first, right? I think I just want to state it again because it's funny. We were just talking a little bit before we hit record on the podcast. We were talking about because we saw each other a little bit ago in Chicago and we're having a conversation. I had to stop and say, this conversation is better than most conversations. So we should stop now and record. But it's amazing to me how little perspective there is on the patient experience. And what we were talking about before that I said hit record is what we think the definition of an entrepreneur is. And there's a lot of people that listen to this podcast who are dentists that own practices, or maybe they're own a DSO and they're not a dentist, or they're in the leadership of a DSO. And entrepreneurship in my career has gone from something that wasn't really a term that was used very much because I'm that old to something that everybody who has a business views themselves as an entrepreneur. And so let me just start there, Dr. Letran. How would you define an entrepreneur?
Thank you. That's a hard question because I think part of it has to do with your why you do certain things. I think for me, when I started and have my dental practices, I was actually learning from people outside of dentistry. So I think I started there first as an entrepreneur because outside of dentistry, when people have multiple businesses or they have a team, a large team, they take themselves out of the business, right? And they become that visionary and they go from one project to the next. So when I start getting more involved in the dental community and I started doing workshops in the dental community since 2018, I started seeing, oh, our dentist friends, a lot of them are just focusing on one thing. I have this dental office, I have these people who work for me, and that's it. And like you had shared in one of the meetings in Chicago that we met, the entrepreneur go from one project to the next. They they embrace change, they take on those challenges, and they want to create that bigger thing, the bigger impact. So as an entrepreneur, I think I don't just back when I'm that old too, but way back when, I think I was one of the first one who bought the scanner, right? I still remember when I bought the scanner, there were only two labs in California that you could send the case to. And after I bought the thing, I'm like, what do you mean there's only two labs? And because it's always something new. And for me, it's always about the patient, right? Because I'm not a tech person at all. But if this thing is gonna wow the patient and this thing is gonna do a better job for the patient, I'm all for it. So I'm the one that go and buy a building, a larger building, put all this technology in because I want to serve the patient better. You can go and buy a bigger house and that would benefit you and your family. Most people don't need a bigger house because at some of us at our age, we start downsizing, right? Because you have a big house, kids move out, and you don't need it anymore. But when you're having a business, when you have a bigger place, better equipment, better team, then you can serve the patient better. And so I always look at that. What makes it better for the patient? What is the return on investment for us? Because then we get that money back, we get that return back, and then we go and we get onto the next project and we try to impact more lives. And like for me, I'm looking outside dentistry. And when people know that's who you are, you go into the next opportunity, but it's not a quick, rich kind of thing just for yourself, but you're looking for bigger impact. People start inviting you to other opportunities. And a lot of time it's even outside, really outside your comfort zone and outside what you usually do, just because they see that you have that vision and you're looking for that impact and those changes.
Yeah, I totally agree. I think my coach, Dan Sullivan, says that an entrepreneur is somebody that takes something of lesser value and increases the value. It's pretty much simple like that. And like you mentioned, I think it's not about money. It's about, you said impact. I think it is about creating value. For some people, it might be social impact. It might be, in my case, I just want to have the biggest impact on the oral health, basically, and wellness of patients. And that has gone from seeing patients one at a time to running multiple practices to now trying to write standards and to create technology that elevate everything now in dentistry, moving into like overall wellness too. And I get a lot, I'm very much in the, I love the startup space because I don't know, there's some miswiring in my brain that I like the most difficult, challenging, risky part of business, which is like
Uh-huh.
taking from nothing to something. And so
Right.
I work with a lot of startups. And I have a lot of founders who they have a business and they're looking to create something and then sell it. And they're looking for provide economic security for their family or whatever. And in my mind, that's not an entrepreneur. That's somebody who has a business. And if you're looking, if you know that it could be an entrepreneur, but a lot of people who are just like looking to exit for a specific goal and then be done. That's somebody who's just looking for their business person, or which is different than what we're talking about of serially looking to do whatever you can to create the biggest value or improve things. And when people come to me with ideas, and if they have multiple ideas, like you do, right? I usually tell them, I say, you know, if you think about actors, it's much easier to be, I always say Vin Diesel versus Tom Hanks. Like if you
Uh-huh.
have one
One
idea and you
thing.
put on that simple, right? Yeah. It's easy to do like
Right.
the one thing. It's longer and harder to do 140 different things like you have, Dr. Letran, right? But then eventually there's a tipping point where you just get to be known as an entrepreneur or an innovator or a visionary or somebody that just isn't known for one thing, but for many things. And we can all think of the people in the public, like if you look at Richard Branson, he has banks and airlines and started off in music stores and whatever. And he's the single thread through all of it versus I don't know, more like Howard Schultz from Starbucks, right? Which who's also an entrepreneur, let's be real, but is known for something more specific. So let me ask you, because I've thought about this a bit, and it's very hard to be known if you're a dentist in dentistry to be making that leap from I'm a dentist to with a product to I do a whole bunch of stuff and I'm a visionary entrepreneur innovator. So I'll ask you two questions. One, how did you do it? And two, how do you view yourself?
Yeah, that's a great question. First of all, I don't think I set out to do that. I think curiosity get me into trouble all the time. You say your coach is Dan Sullivan. I work with Dan Kennedy. I think they're very
Oh, that's
similar.
great.
He recently wrote a fax to me and he said, just a personal observation, you get into the middle of everything because when we're on the coaching call, I would tell him, this company approached me and say this, and they invite me to do this. What do you think? And then I got him involved. Not so much like making him really involved, but for example, if I talk to a magazine, I say, you should have Dan Kennedy write in your magazine, right? Because he's that kind of a figure. So
Hmm.
I think the first thing is when you get curious and you like to get into different things, and a part of that is studying the same for reading, right? So I started out reading a lot of different books because I was trying to learn business. Obviously, we don't have a lot of that from school. So it was like trying to learn everything. And I tell people one of the first book I read in personal growth was Awaken the Giant Within by
Oh,
Tony
okay.
Robbins. So I read that book and then I went to the reference and I read all of those other books. Rich Dad, Poor Dad, Think and Grow Rich. And I read all of those books. And so I started in that journey. So I think if everybody have a passion and not everybody have that big vision. I think one of the way to have the big vision is to study, to read, and to be around other people because other people who are different than you, they're the ones that sometimes share ideas. I ran into one of the doctor here at an event that I'm at. She studied to be an attorney. She already became an attorney and she does multiple things. And I was telling her about my other friend who's thinking about retiring. And I'm telling her maybe you should buy his practice, right? A law practice. So she's now you're getting people into law too, like introducing businesses. Excuse me. And that becomes, I see myself as a connector now. right? As a connector, when I'm talking to people and they describe their dream, their vision, I see who can help them solve that. Maybe somebody has a resource, or maybe they need to talk to that other expert. And then I'm connecting them so they get their problem solved. And then I guess I put one more deposit into the relationship bank. But I just do it now. It's almost second nature. I talk to someone and I introduce them to opportunities and things like that. So I see myself as that. Now, the funny thing is, every time I go somewhere and I say, okay, I'm away from the dentistry thing, I'm going to go hang out with whoever, people will remember me as a dentist, right? They'll see me, I saw you 2 years ago and you're the dentist, right? And so,
100%.
yeah, and I think because our core is always with us. Right. But now it's better because people they don't see you as a dentist and start talking about their teeth, right? Because that's very common. Now they can actually appreciate because you have made certain connections or they see you doing different things. And then now, so they do see you as an entrepreneur because you're doing different things. So I think that's one of the things the public look at is, hey, this person can do more than one thing, so be involved in more business. Um, for the past 12 months, I have become a journalist. I have become a real estate investor. I was investing in real estate, but now it's a very big project. I was introducing people to deals. So people go, oh yeah, bring me that deal, bring me that, bring me the other deal. And I wasn't really bringing deals. It was just when somebody share an opportunity, I see the value and I would go and tell somebody else. And now I'm also going to be a co-founder of a film festival, the Los Angeles Tribune International Film Festival.
Very cool.
They see me as bringing in those relationship, as having the vision as a business person, because that comes first. 33 years in the dentistry business. Dentistry is unique in a certain way, but in other ways it's very similar to other ones, right? If you own multiple offices, I own a couple of offices, group practices for many years. People see that too. You're not just doing one thing, you have other things, you have other doctors working with you. So if we throw you in this other situation where there's a group, you can probably handle it. I think you should just be who you are, but at the same time, we should all stretch a little bit and do it beyond what we're already doing. And as far as the patients are concerned, as you say, putting patients first, I even connect patients together. This patient is looking for care for her parents, and this patient owns a senior service center. Let's connect them too.
Oh,
So
that's great.
it goes beyond fixing the teeth.
I wish I had your superpower of connecting people. I think I know a lot of people. That is certainly not my superpower, but a couple of things I wanted to ask you about. You hit on a, a big thing that I've been talking about lately too, where within dentistry, I'm in more and more meetings now where I'm the only dentist, and I have to tell people, by the way, I am a dentist because
Mm-hmm.
there's so much of dentistry now is, and this isn't new, is being done by, is the dental industry is actually run by non-clinicians. Let's just be real, right? The people that
Okay,
are running
right.
large groups, the people that work in a lot of the supply companies, distribution companies. And I was talking to somebody at one of the large software companies today, and he was talking about how they were talking to a DSO client that they have, and they're talking about developing some new technology. I'm like laughing at it because it's just going to
Mm-hmm.
fail. Because he's saying there's not even there's not a clinician in the room. Nobody's actually seen a patient. And they're talking about a clinical technology that they want to create. And that's not uncommon. I would also say the same thing is true because you're a coach and you do consulting for people and connect people. And there's a lot of coaches and consultants out there that not only haven't had a successful dental practice, but they've never even had part of a dental practice. And I think that's frankly dangerous. This isn't the same, like you don't necessarily to perform heart surgery, you don't have to have had heart surgery, right?
Mm-hmm.
Because the two don't correlate, right?
Right, right.
However, if you're going to be talking to dentists, implementing technology and practices, people how to grow their practices, and you haven't done it yourself, frankly, I think it's a little bit disingenuous, not because, particularly if look, if they have a massive consulting company where they have lots of people and it's very successful. That's one thing because at least they know how to run a business. But there's a lot of people who there's 5 people and they're trying to tell dentists who have 10, $20 million businesses how to run their business. So that's my sort of jaded way of asking you the question about, I feel that especially at this moment in time where we have decreasing profitability and there's a lot of external forces on dentistry, that the next phase of dentistry is going to owned by clinicians who know how to scale dental practices. And I think that companies that don't have clinicians in their ranks, in leadership positions, I think I would be scared if I was one of them. Do you agree with that sort of perspective?
And thank you for that insight. I think let's just talk about the coaching part real quick. I think the guilt is on both sides. I've learned that a coach is different than a mentor. A mentor is usually somebody who has already done it. And then now they're holding your hands, they're leading the way. Excuse me. I'm in Vegas and this is part of the problem with all the smoking. They're leading the way and they have that experience. And that's the mentor. The coach don't necessarily have to be in that business. They bring in a different perspective. They push you and so they don't, like, for example, a coach for, let's just say, a sport coach, right? Or a coach for an Olympian, they don't necessarily have participated in the Olympics or they did not win a medal, but they can coach someone to win a medal, right? And then there's the consultant. I think you were talking more like the consultant because I think the majority of people in this space in dentistry are consultant. They're the one that just tell you what to do. Here's the answer, do this. The coach is supposed to ask questions so the client can figure out the answer. And I'm very proud to say I'm a combination of both because I have the training as a coach. And then as a consultant, that's the 33 years of dental experience. But I think the guilty part on the client is, have you done your due diligence? And a lot of time there's a lack of clarity. For example, they would say, I want you to come and train my staff. And as a coach, I asked the potential client, have you trained your staff? Have you given them the resources? And have you actually spent some time with them? Or you didn't, like you just randomly tell them this and that, and now you want me to go in there and train them, which is, I can do that too, but what have you done yourself? And when you're trying to do it piece by piece like that, then yes, you can bring in a consultant, somebody, let's just say, oh, I just want to grow my hygiene department. And then you bring in a hygienist to come in and grow your hygiene department. And that's just one piece of the whole big story. So I think if the dentists in general were actually honestly looking at themselves in the mirror and say, I need help, but I think I need help for myself, right? Because I'm not a leader. I own the business. When you own the business, it doesn't mean you're a leader, right? Because you don't know how to deal with people. And for me, I tell people, if you've been out for 5 years and you say you don't know how to do something, it's on you because you need to spend the time to learn. I don't care how you do it, but you have to learn it. It doesn't just come naturally. You don't just own a business and all of a sudden accounting, if nobody taught you, you would have to read up on it. Somebody taught you, you study it. I remember going to seminars, reading newsletter. And reading books. That's how I learned all of these business. And then at a certain point, okay, I'm working with a consultant and now they feeding you information, right? That to me, it was, oh, I never knew this before. It's not that I was dumb. I just didn't know. I wasn't looking for it. So I tell our colleagues, I was on a call with a doctor one time and he goes, yeah, I'm working on my 5-year startup. And I'm just like, a doctor, 5 years is not a startup for a dental office anyway, right? Because maybe 2 years. But if you tell yourself you're in the startup phase, I think you're going to give yourself all the excuses. I'm still in the startup. I don't need to do this or that. But if you tell yourself the startup is 2 years, you need money, get some working capital, put in marketing and get somebody to help train your team. That's the other thing is the mindset of dentists in general is very individualistic. they don't work as a team. You don't need to figure out accounting. Please work with a CPA that can do that part for you. You have questions about HR, the companies that does HR, that you can pay them and they give you the resources, exactly what you need. If you're in the wonderful state of California, there's only so many companies that want to deal with California because of the particular laws. Why are you trying to figure it out all by yourself? Why are you going into a group of dentists and ask all these questions and people give you the answer? You don't even know who these people are, right? I've learned to have my own team, to have people who support me for what I need to do. And I think for a lot of us, we're just taking things passively, and then there's a fire, and so now let's just bring in somebody to help solve this. But the problem is bigger than that. A lot of time, I think the problem is leadership, which is the dentist. How you think, how you guide people, what kind of values you share with your team. That's like problem number one. You have value A, B, C, and they have D and E. So your values don't even match. So when you push them, say, hey, we want to make more money because I have this particular philanthropy cause that I want to support, or I have this dream or whatever, and the team is all, this doctor is all about money. They don't even know what you do with the money because you could be just giving it all to charity. And lead with people, share your values so they are all clear why they're doing certain things for you. I think you can just strengthen your team there. When you bring in an outsider, if you know what you're looking for, then like you said, make sure that person actually know how to do it. The business coaches out there that don't have a business, right? And what they teach you is the stuff that they learn from somebody else. But I think it go back on you to do the due diligence. Like how many businesses have this person run? And if you
Right.
just blindly hire the person, then I think it's a little bit on you.
Totally agree. Totally agree. It's just such great wisdom that you just pointed out. I love your definitions of how you separated mentor from consultant to and coach, and how they different, and how it's up to the person who's looking for help to really get to the source of what they're looking for, and how,
Mhm.
yeah, do a lot of things. So what, in your mind, like, what are you working on now to create impact?
I'm growing my coaching business. I have, just like we said earlier, just from the curiosity and the connecting, now I'm seeing myself partnering and working with global entities. For example, there's a leading ladies in dentistry. It's started by Dr. Henriette Lerner. So I was connected to her through a friend, and then I went and spoke in Italy. I met her, and her organization are all women dentists. And these are badasses. I have a chance to travel with them and speak in Dubai with them. These are all perio OS, like they all specialists. They teaching at school, they publish papers, and they want to empower women dentists. But these doctors come from I don't know how many countries. If you go and look at the group, so I'm getting involved in that kind of movement in the country, in the US. Then I'm getting people inviting me to speak and to connect, and again it's more on a collaboration basis. So it's not so much I come in and speak about this or whatever. It's come in and let's talk about this and see how we can collaborate. And it's across industry. It's with medical, with like I mentioned earlier, with real estate, investing in big company. They haven't made the announcement, so I can't tell you. But it's at the level that I never thought that I should be at, or I wasn't looking for it, put it that way. Or right now, working with Dan Kennedy, and you tell him something, and next thing is he's introducing you to somebody that you're like, okay, I'm not sure I know how to talk to that person. It's up leveling myself. I think that would be one description of that, and learning to feel more comfortable to answer to those bigger calls, right? The calling, because the calling is not just, okay, go out there and do the dentistry today. My daughter graduated 2 years ago, so now we're working together. So everybody's telling me, oh, you have a legacy practice. And I go, oh, that's nice. That's a big word. But when you think about it, it is a big deal, right? It's a big deal. Having patients sharing with me that there are 4 generations of them in the practice, that is a big deal. And sometimes we don't think about that. See, that's the thing. I think everybody just want to get, okay, the next $1 million or whatever, or the next 5 practices. And it's the little things that you have been doing that is now building up, and all of that equity, I would call it like that, in the relationship. And take that and go build something bigger. Because if you could do that, so imagine, let's just say each dentist, because this is what I do in my office, right? Each dentist has, let's just say 1,000 patients. And if you actually learn more about your patients and you actually help them grow their business, when you have the conversation with them in the chair besides their teeth, right? They're introducing them to other people, right? So they can grow their business. They become more attached to you because you're more than the dentist. You helping them more than just their oral health or their family. All of a sudden, you're introducing business to them. And I do this, and I think part of that is because of my training as a coach. The other part is just all of us have that. It's the heart, right? We do free dentistry sometimes because that's what our heart tells us. This is what you do for this person. You might go to the next person and you charge them full fee because that's a different patient. But you have the heart and you have that control. So that's one of the things I'm really big when I'm coaching. I tell all of my clients, you need to be giving back. You need to be doing things beyond dentistry for your patient or for the community, because that's where you feel fulfilled, where you don't say, I can't handle dentistry anymore. There are just so many things that make life so rewarding. And the thing is, we have the access to all those things. We all have patients. If I have fun with my patients, or I do free things for my patients, or I introduce my patients to opportunity, you do too. Everybody does, because we all have patients in our office.
Thank you. So I think your perspective is fairly unique in dentistry, and I think your experience is even more unique. And so my suspicion is that there's people who are probably listening to this podcast who are thinking, boy, I wish Dr. Letran was my coach. So where can they go to find out more information and reach out?
They can go to my website, the coaching website. So that is dremilyletran.com. So that's DREMILYLETRAN. There's some courses on there. They can book a call with me. We can chat about whatever it is that maybe one challenge that they have. Okay, that's my goal, is we get on and we solve that challenge, whatever it is. And then we can talk about supporting long-term or short-term. I think I remember way back when Dr. Farhan started Dental Town, right? He said a dentist don't need to be alone. So that way we can share ideas. And then we go to the other extreme now where we're not alone, but then we're sharing sometimes all kind of crap.
A little too much sometimes, right?
Yeah, you go from one extreme where you cannot talk to anyone, and then now you're talking about way too much and all kind of stuff. And sometimes for me, it's like, what's most important today or this month, or what is that next goal? Just focus on that and just talk on that, because I see people spending a lot of time talking about stuff that I personally don't think that it would make a difference in that person's life, right? The majority of the time, but whatever the discussion may be. And then somebody like you who take a trip and go to 3 meetings because you're very focused and you have that goal. I'll make one more note. I think last year I was walking through, I don't remember which conference, and I saw Fred Joyal, the founder of 1-800 Dentist. He was over here, and I was just walking over here to get whatever. And then when I come back, I said hi to him, and he said, I saw you too, but you were walking with a purpose. So I didn't want to stop you. And I told him, I could be walking to the bathroom. The thing is, people notice you like that. That's what
Oh,
I'm saying. Like, she's heading that way. She must have something important doing there, right? Rather than somebody who's just strolling. And it's great when people notice you like that. And so they know that you tend to be focused. You tend to have a particular goal when you go somewhere or you're in a conversation. And you were asking me earlier how you want people to see you or how you see yourself. I want people to see me like that, as a connector and as a very focused person. I usually have something to do.
Yeah. Thank you so much, Dr. Letran, for being on the podcast. Very enlightening. Go to dremilyletran.com to find out more, and what great insights. Thank you.
Thank you so much.